So greetings. Hello, everyone. I'm Dr. Patricia O'Gorman, and I co-chair with Dr. Maureen O'Reilly Landry, the COVID and Healthcare and Addiction Task Force under the Trauma Division of the American Psychological Association. And I invite you to come visit our website and look for other webinars. Today, it is my great pleasure to be interviewing someone I have been following for quite a while, and hopefully after this interview, you will as well. This is Dr. Aaron Weiner, and he is a licensed psychologist. He is a passionate speaker. He's a prolific writer, and he is going to be talking to us today and addressing a concern we all have about the opioid epidemic. But to begin, I'd like to know from you, may I call you Aaron?
Well, of course, and thank you for
Oh,
that
thank
kind
you.
introduction.
Well, thank you. What, with someone with your background, what has gotten you so involved in this critical area? Because you not just dabbled in it, you have taken it over. And so if you could share your perspective on you, your motivation.
Of
Um,
course, yeah. So psychology as a whole and addictions as well. I like to say I fell into it because I was impatient, and by that, what I mean is that when I get to grad school, when I got to my doctoral program, I was just so eager to work with people rather than just go to classes. The only place on campus at the University of Illinois at Urbana-Champaign that would take a first year doctoral student was the Alcohol and Other Drug Office, and that's really what gave me my start. And at that point, the shoe fit. It's interesting. The addiction and recovery world it's got one element that's very therapeutic. There's another part though that's very educational. I
yeah.
think that a lot of times folks aren't they don't fully understand what they're going through, and when you help empower them with that knowledge, that allows them to work with those underlying factors more effectively. And so I kind of went down that path for a while and eventually found myself in a leadership position
Yes.
in the Chicago area. And it was there at a psychiatric hospital where I started working more with systems. And I gained a huge passion for systems
Yeah.
because I recognize there's so many people suffering right now that we have to look at where is this coming from, and that prevention of problems either starting or growing is absolutely critical. We can't see change without that. And I was noticing that that was an area that was lacking in terms of time and attention. And so I've really turned a lot of my focus now to that. How do we go upstream model of how do we really try to get at the source of these problems in a population health and a public health sort of lens, and we see then those changes and solutions impact the lives of individuals.
Wow. And that led you to actually become the past president of the Addiction Society for the American Psychological Association, where you've brought this passion and you've brought your clarity to what is happening with the opioid epidemic. And I wonder if you could share that with us, that what happened in COVID that somehow powered this fentanyl epidemic to the point that we're all, I think people are numb by it at this point. But if you could share that with us, what is going on?
Right. Well, so what happened over COVID was we saw this huge spike in addiction-related deaths, and it wasn't just opioids. I believe opioids, it was somewhere in the vicinity of a 30% increase, but we saw something very similar actually with alcohol-related death as
Yeah.
well. We've seen it really across the board, this exacerbation in problems around, I'd say, a lot of different areas of behavioral health, not just addiction. But for addiction specifically, part of what happened was that a lot of the peer support communities that were so helpful to people, like your Alcoholics Anonymous, your Smart Recoveries, those sorts of things, as well as even residential programs, outpatient clinics, they stopped being able to function as they normally would. And so the support structures that folks had were no longer as available. We had this huge, intense surge in isolation, in depression, and anxiety. And
Mhm.
so there was this pull back towards these less healthy or even unhealthy coping strategies. For opioids in particular, this unfortunately happened at the same time that we've seen fentanyl just come in more and more and more across the country. And fentanyl, for those who are less familiar, is up to 1,000 times as strong as morphine. And that means that if you're opioid naive and you take fentanyl either intentionally or increasingly by accident because it gets mixed in with cocaine, gets mixed in with meth, then you could easily find yourself overdosing when you didn't even think you were taking an opioid. So you put all that together, you made for a very dangerous combination.
Yes, yes, it has. And have you also found that kids even taking what they think may be Adderall and it's laced with fentanyl? And also we're seeing that. It's coming up, I think, more individually, but I wonder about just the data of just it's just getting into the system, getting into every part of the system.
Yeah, so I don't know about Adderall specifically, but what I can say is based on the data that
Yeah,
adolescents are the demographic that's seeing the biggest spike in overdose deaths right now, and it's entirely because of this fentanyl contamination. A lot of the pills that people will buy off the street or off the dark web don't
right.
come from pharmacies. They're called press pills. They're essentially made they're made illegally. And when you do that, anything could be pressed into these pills. So someone might think that they're getting Adderall, but in fact, and maybe they are, but there's also something else that's been mixed in.
And that's such an important point that our kids don't know what they're taking. And with some of the kids I have worked with, um, they've said to me, well, they trust their drug dealer. And I've shared with them my perspective that their drug dealer doesn't even know what's in all this. And so that's that's part of this is who can our kids turn to? I mean, who do you find kids talking to besides their drug dealers to get any information about what they're taking?
Yeah, why? So I think that if kids are getting their information about health related decisions from drug dealers, something has gone wrong
Yes.
in that young person's life. I think that where are they getting their information from? Hopefully, to some extent, parents, pediatricians, and other healthcare professionals would be great. I
Mhm.
think though what we're seeing is that when it's not addressed by those really important adults role
Yeah.
models and authority figures when we're not stepping up to the plate, they're instead getting these narratives from Snapchat. They're getting it from Reddit. They're getting it from watching like TV shows like Euphoria, for example, which create these caricatures of high school life with bunches of sex and drugs. They're getting it from other places, even say their peers who are trying to justify their own behavior and kind of give themselves a permission structure to
Yeah.
continue doing what they're doing. We don't want that because those sources of information are incomplete at best and harmful at worst.
Yes. So what can a parent do given that? I mean, given that, it is Snapchat and TikTok even that our kids are being fed this. What is the role of a parent? What is the role of a teacher in terms of trying to interrupt that?
Mm-hmm.
Um,
Well, so interrupting is tough. We can talk about that as well, but preempting is best. So
okay.
essentially, once there's a narrative in somebody's mind about how to understand, you see this in politics as well, right? They talk about setting the narrative or
Yeah.
defining the other candidate. The same thing is true in so many areas of life, where if you can talk to children before they encounter it in the wild, like say when they're still in middle school, somewhere around there, and give them accurate information. And equip them to make these decisions, help them understand why some people might be attracted to it, uh, but then ultimately how that's potentially very harmful, self-defeating, and dangerous. Instilling in them values around valuing your health, valuing your body,
Uh-huh.
the importance of following rules and laws as well in terms of their future. These are all norms that you can instill in them early. That said, if you are coming to this, if you're listening to this and you have older children and maybe you haven't had these discussions, the most important thing that you can do is not make it a topic that you can't talk about. So there's a phrase that I did not create, but that I really like. That's or rather, 61-minute conversations are much more important than one 60-minute conversation. And that's because you want to normalize this. You want to just have it be something where you're in touch about what do they see in their world, at school and their peer groups about vaping, about pills, about drugs. Is this something that's coming up for them a lot? Just asking, staying in touch, asking how they feel about it, talking about how you as parents feel about it, so that it just becomes part of the fabric of what they understand and what they know.
That's great. That's great advice. Thank you. Thank you. It's talking to your kids as opposed to talking at your kids. So, and what is xylazine? It almost sounds like a musical instrument. It's hard to believe that something that sounds so pretty is so deadly, and yet we're finding it also creeping in. So,
Yeah, yeah. So when we talk about fentanyl, we're hearing a lot more about xylazine recently,
yeah.
and xylazine is actually an animal tranquilizer, and
Oh,
it's oftentimes, yeah, it's mixed in with street drugs, mixed in with opioids because it basically it prolongs the high that you feel from it. So it'll last longer if you mix xylazine in with fentanyl. The problem is though that the way that fentanyl and other opioids kill you is that they are central nervous system depressants. So they slow down your breathing, they slow down your central nervous system. So is xylazine. So you're basically layering on more sedation, more CNS depression. But
uh,
unlike fentanyl and other opioids, xylazine, it's not an opioid, so it doesn't respond to Narcan. It doesn't respond to naloxone or other reversal agents. And so what's happening is when we're trying to revive folks, not only is it more likely that they're going to overdose, but even then, depending on how much xylazine they've taken, the naloxone might not revive them and bring them back. So that's why we're hearing about it, and that's why it's so deadly.
well, where are kids getting the xylazine? I mean, how pervasive is this?
It's not that they're taking it separately, it's actually being mixed in to what's
Okay,
being sold. So it's not like they're buying some xylazine, they're buying some opioids, and they're
okay.
taking them both. It's just something that's they're not even aware that it's in there a lot of the time. Its prevalence is different depending on the geographic area of the country, but I think in most areas at this point, it's a double-digit percentage. I don't think it's over 50% of overdose deaths. I don't think it's gotten quite that high. I think in most places it's between like 15 and 30% at this
Mhm.
point. So really the way to think about it is that it's just another one of these contextual factors that's making the opioid epidemic even more deadly. You can still overdose from heroin alone, from fentanyl alone, from hydrocodone like Norco or Percocet alone. But when you start adding in things like xylazine, that makes it more deadly. If someone say is also prescribed a benzodiazepine like Klonopin or Xanax or Valium or
Mhm.
Ativan, that adds on a layer of central nervous system depression that also makes it more likely that you're going to overdose. So the xylazine is just another trend that's making the current crisis even more deadly.
So for those people watching, for those parents whose kids may be on any of these prescribed medications, drug use in general is therefore much more dangerous than
Hmm.
than children who aren't on any prescription medication.
Yeah.
Um, wow, wow.
But whenever you're mixing medication, polypharmacy, it increases the risk of overdose. Like if you think back to most, say, like celebrity deaths that are reported on in the news and they release these toxicology reports, it's never just one thing. There's always like multiple substances in their system, and that's because when you start mixing these chemicals, if they can be deadly on their own, you start mixing them together, things get even more dicey. But in particular, right now, when we're looking at the polypharmacy trends for overdose death around opioids, we're seeing xylazine being there a lot. We're also seeing methamphetamines more present here in the past couple of years as well. And then benzodiazepines, those anti-anxiety drugs, have always been a huge risk
Yeah.
factor because of that interactive quality with opioids.
Wow. Um, since most of our audience are mental health professionals, and in my experience with my peers, who I dearly respect and love, they don't ask about drugs very frequently. What advice do you have for the mental health professionals who may be watching this, and how to maybe introduce asking about drug use in a client where they may have even a minimal concern?
Yeah. Well, so a couple suggestions. One would be I'm a huge fan of semi-structured interviews for your first session. So really just that way, when you use a template, at least as your base, that makes that ensures that you're going to cover all the really important bases to cover and you're not going to miss anything. It's easy to go away from that sometimes if you're not, say, like in a hospital system where Joint Commission is reviewing your records. But I really strongly believe that if you even level set with folks at the start that day one, I'm going to ask you some questions. That's going to be part of the process. That helps just make sure that you cover these important bases. That said, if you'd like, or if you're wanting to streamline it, you can also give out a questionnaire. Sometimes that also makes it a little bit less threatening for your clients or your patients to respond if they're feeling like maybe they'd write it, but they'd have a harder time saying it to you in person. There are free open source screening measures, for example, that you can get. Um, the assist is one that comes to mind. The audit for alcohol, there's several you can use where you can get some of that preliminary information and not have to ask them about it directly if you feel like that might either be the way you want to go entirely or as a supplemental method where you both ask about it verbally and they fill out a form.
Well, thank you. Thank you for that.
Yeah.
And thank you for your time today. And listeners, please follow. I follow Aaron on LinkedIn. I love him. He posts, I don't know, how many times a day do you post?
I think usually not more than once a day, but I try to do a few times a week
Yeah.
with
Yes,
information I
yes.
think is relevant.
Yeah, wonderful, important, and obviously timely information. And also, please visit his website, weinerphd.com. And if you are thinking about a speaker in your community, contact him. He's fabulous, which is how I found out about him through a colleague who knew him and heard him talk. So please, make this something that you are doing with your clients and in your community. That, again, as Aaron said, you're not having the 60-minute talk, you're fertilizing it within things you say and are curious about. So thank you, Aaron. Thank you so much. And we look forward to your talk. We will have them for an hour on April 5th. Thank you.
My pleasure. Yeah, I hope listeners, I hope you'll join us. It should be a really great hour where we'll talk about all these topics and more around what's going
Yeah.
on with opioids, and we should have some time for questions as well.